Hi, it's 7 o'clock Eastern Standard Time, and I'm Yvette McQueen, MD. You're on my Facebook page. I'm here to talk live about heat stroke versus heat exhaustion and what to do. So I will wait 1 minute to see if anyone joins me. I hope someone's out there, some colleagues, some friends, anybody who's interested in this topic, because it's been tossed around in the news. We have had, actually it's August and the temperature is actually going down, but July was a very hot month across the United States. So anybody out there live willing to discuss heat exhaustion versus heat stroke, some signs and symptoms, things to watch for, and what to do. That's what I'll be talking about. Let me get my notes together. So anybody out there, just flag, wave, let me know you're out there. So I'll just give you a little discussion. I am Yvette McQueen, MD. I'm an emergency physician and travel doc, a global physician that is interested and on a mission to educate about health, travel wellness, and disease prevention. And disease prevention or accident prevention, we concerned about preventable accidents that causes death and disability, but it can be controlled. So that's what I'm going to talk about today. Anybody out there, just wave, let me know you're listening to me. If not, this will be a recording and I will place it on YouTube and Google Plus under Yvette McQueen, MD, who is me, emergency physician and travel doc. Yep. I'm actually out here sitting in the humidity. Beautiful, beautiful evening. Kind of temperature is great, but a little humid. So let's start talking about heat illnesses. So we lump them together in as heat illnesses. So we can start off by one of the reasons I'm talking about this today. I was listening to GMA, and ABC News also referred to it on another channel, regarding a child that had a heat stroke indoors, because everyone always equate heat illnesses with sun exposure, but it also can happen indoors. And so evidently in this case, the child was placed in a room with very low ventilation. The sun was coming in through the window and there was no air conditioning fan, and it became a sauna box for the child, and she suffered a heat illness. It can also occur in factories. It can occur in warehouses where people are working, particularly during the summertime. But some factories, the machinery can cause severe, oh, I think I like that better. Take that light off. They can cause severe heat in the factory, overwhelm people, and they can deal with heat exhaustion. So the least amount, or on a lower scale, we think about heat cramps. So heat cramps deals with a lot with your salt depletion and your electrolyte imbalance. So your muscles will start to cramp up, become sore. You feel it mostly like in your arms and legs, in your abdomen. Your muscles just feel really tight and cramped. The best thing to do at that point is to remove yourself from the environment, go in shade, air condition, drink some water, consider electrolyte replacement, and you can try any of the electrolyte replacement drinks, no certain brand, even though I'm in Florida. And remember to stretch your muscles. So, stretch your muscles out because it's cramping up. If you're not any better after an hour of removing yourself and doing those tips, then you probably need to seek medical care. Go to the ER. And I'm an emergency physician, so when I tell you to go to the ER, I don't say that very lightly. So trust me on that one. The next one will be talk about heat exhaustion, and you hear this sometime, and people do say either heat exhaustion or heat stroke, but there is a steadily difference between the two. So heat exhaustion, you're in those people that are at risk are once again warehouse, factory workers, those that work outdoors, the elderly, athletes. So heat exhaustion is you get very sweaty, profuse sweating. You get clammy. You're losing a lot of salt from all your sweat, so you actually start to sweat a little bit more. You're almost like drenched in sweat, and then you get like that fatigue, and you're getting very thirsty because people are usually underhydrated, and if you're in, you can usually lose at least a liter of water if you're profusely sweating easily within 30 minutes. So at that point you get a rapid heart rate. Your heart start pounding, and you get weak, and your muscles are cramping, and you may get nauseated, vomiting. At that point your body temperature will start to rise. It is up. So what you want to do is drink water. This is when you have a slow rehydration. You don't want to drink too fast, but you want to drink water, and you remove yourself from the heat environment, and you cool yourself off, air condition, relax those muscles. And if you're once again not any better within an hour, please go to the ED. And then there's heat stroke, which is the most severe. Heat stroke means that it's somehow messing with the brain. Your mind starts. So at this point, your body temperature has gotten so high that it's actually you're overheating your brain. So that's when you get dry. You're no longer sweating. So that's the difference between, you got to look at heat exhaustion and heat stroke. Okay, so heat exhaustion, you're profusely sweating. It's just coming down, it's coming down, it's coming down. Heat stroke, you're no longer sweating. Your brain is overheated. You start to have a headache, and then you also start to get confused. And some people like to use that word lethargic, but that means that you just become delirious and confused. You're not answering questions appropriately. You may have some blurry vision. You get nauseated. You're vomiting. That usually means your body temperature is somewhere over 103. That's severely hot. You do get a rapid heart rate, and sometimes people, if they do not remove themselves from the environment, they may lose consciousness and actually have seizures. So what do you do? Okay, heat exhaustion, heat stroke. If you see someone in this situation, you don't necessarily have to say it's one or the other, because what you need to do is remove them from the environment. Remove them from the heat. You remove them from the sun. You put them in a cool environment, hopefully an air-conditioned environment. You want to cool them off. So you take some wet, cool rags, place them in different places on the head, on the neck. You can take ice packs and put them under the armpits, in the back of the neck, in the groin area. That will help to cool someone off rapidly. You can spray them with water. And because if you have heat stroke, you got to remember they're not sweating. So sweat on your skin with the water is a way it evaporates evaporates, and it's actually a way to cool you off. So if they're no longer making sweat, they need that water on their skin to help the skin cool off and evaporate. That's what you want to do. And not call 911. Don't hesitate. Call 911. You definitely heat cramps. Remember I said you don't feel better after an hour? Go to the ER. Heat exhaustion. You don't feel any better? Go to the ER. Heat stroke. Please, please, please call 911. Get someone there. I know, unless you're exactly across the street from the hospital, it sometimes is safer for you to call 911 where someone can come there and start the treatment right there instead of waiting for you to drive and then get any treatment. That sounds like another topic I need to do later, like when to call 911. So with heat strokes, you think someone has heat stroke, please call 911 so they can get immediate treatment. But in the meantime, you can ice them down, spray water on them. They, once again, if they're conscious, you can attempt to have them drink water, but you don't want them to end up vomiting and going to their lungs because they're unconscious or they're so delirious they can't control how they swallow. So that's the suggestion. That's why you want to cool the outside part. In CNN and the Weather Channel was also discussing it today, because CNN said that it was reported that there was more child heat deaths from being left in a hot car in July than ever was. And also on the Weather Channel, I was watching the Weather Channel earlier, and they had one of their meteorologists sit in a hot car. And people say, well, I had the window crack, or the window was down. But you got to remember, a car is an enclosed area. It's a box. And in the summertime, with the heat being 90 to 100, with the heat index, a car can heat up to over 120 very easily in less than 10 minutes, they've shown. So they had their meteorologist sit in a car, and this was an adult, and she lasted, I think it was about 21 minutes before she started to get lightheaded and dizzy and she was very shaky, and heart was racing and blood pressure was up, which at that point she was going over the edge for the heat cramps into heat exhaustion, just sitting in the car. So that's an adult. So you know, with a child in a car, they have no control of their body temperature, or less control of their body temperature, and it becomes they go into heat exhaustion and heat stroke rapidly. And so children in cars left in cars, so they're telling people, or parents or whoever take care of children, put something important in the back seat. So if you put your child in the back seat and you're strapping that child in a car seat, put your purse in there next to him. Put your phone next to him, because most cars, modern day cars, will pick up the phone and you can talk on the phone. You don't actually need to touch your phone. So put your phone, put your purse, put something very important in the back seat with the child, and so that you remember they're back there. You don't get out and go into the office because you're thinking, oh, I'm late for that important meeting and I need to get there, and you just go and end up having a tragedy, a preventable death. So these are the things you should remember about heat illnesses and what to do. So heat cramps, remember, it's your muscles and pain in the legs and the abdomen, and you want to replace your electrolytes and salts. So drink water, water, water. Remove yourself from the environment. Not better in an hour. You know, you need to go to the ER. Heat exhaustion, you're profusely sweating. Sweat, sweat, sweat. Your temperature is up. Your heart is racing. You may be nauseated. Remove yourself from the heat environment. Go in a cool air-conditioned area. Relax yourself. Drink water. Electrolyte replacement. If you're not better, go to the ER. And heat stroke, Always think stroke deals with the brain. So this is a heat frying the brain. And you become delirious and confused and stumbling and a headache, and you're dry. You're not sweating at all. Immediately try to, you or someone else, dry the person or wet the person. Spray them with water, put ice packs in their armpits, cold, cool rags, call 911, and get help as soon as possible. So some preventions from this. Once again, we're in the summertime. Remember to hydrate yourself. Hydrate, 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 please. And most of the time, that's best with water. You should be drinking half of your body weight in water. So if you weigh 200 pounds, you should drink at least 100 ounces of water per day. So half of your body weight in ounces will keep you hydrated up. And remember, you should try to, if you know you're going to be in a heat source or outside in a heat environment, you need to hydrate, pre-hydrate. So start drinking before you get into that heat environment. Wear light, loose clothing. Cotton is a very, very breathable clothing. Light, dark clothing will absorb the sun rays more and absorb the heat. So you want to use light clothing and light colored clothing, lightweight clothing. Try to avoid the sun between the hours of 11 a.m. and 3 p.m. And definitely, if you have to be there, don't stay out in the sun greater than an hour. You gotta use increments. You need to work out there, you do it, you remove yourself from the heat. You're out there for 45 minutes, you remove yourself from the heat. Replace your salt and electrolytes if you need to use electrolyte replacement drink. And make sure you pace yourself. Pace yourself. Don't ever overexert yourself. If you know you're an athlete and you need to train, try doing it early in the morning or late at night during dusk when the sun is down and it's a little bit cooler away for those times. So I don't see anybody on here with me, but I hope someone's out there listening or someone will listen later. So I hope you have enjoyed those tips and this is helpful for people regarding heat cramps, heat exhaustion, heat stroke, any of the heat illnesses for prevention and what to do. So my name is Yvette McQueen, MD. That's YVETTEMCQUEEN, MD. You can find me on Facebook here. This is my Facebook Live. Find me on any of the other social media like Instagram, Twitter, Google Plus, or YouTube. Actually, coming up soon on my YouTube channel, I will be having some demonstrations for CPR and first aid. I also plan to have some courses and webinar on wilderness first aid. So emergency physician travel doc, it is my goal to help have you travel well and safely so you too can enjoy those vacations and experiences. Follow my tips, blogs, webinars, courses, and even private consultations as a physician. So for now, good night. Enjoy the weather, the rest of the summer, your vacations, and wherever life take you. Ciao.